Every country has some interesting facts about it that most might not be aware of, which makes many of them surprisingly remarkable and unique. One of them is Taiwan, a small island in the western Pacific Ocean that lies roughly 100 miles off the coast of southeastern China. With 23 million people crammed onto an island that covers just more than 36,000 square kilometers, Taiwan ranks among the 20 most densely populated places in the world. Taiwan has become one of Asia's major economic players and has one of most efficient and appraised healthcare systems, which is the main topic that we will talk about in this video. Taiwan is widely known about its free Wi-Fi that you can get at any spot of the island, its animated news coverage that animates news in only 3 hours, and their Hello Kitty obsession. The other one is universal health coverage. Its national health care system is ranked first in the 2020 Health Care Index, 14th by Global Access to Healthcare Index in 2017 and currently 12th on the Health Care Efficiency Index. And more importantly, today, 25 years after its creation, people's approval for its health care insurance program is near its all-time high, over 80%. Before the NHI was established, Taiwan had 10 different public insurance schemes, each covering a particular subset of the population. Together the 10 programs covered 59% of Taiwan's population at the time, leaving uninsured the other 41%. By the mid-80s Taiwan's country started to amass quite amount of wealth that had come with its economic development, but it still had a poor country's health care. Public demand for better health insurance coverage was increasing, so Taiwan's government set out to design a national health care system from scratch. They had meetings with a lot of specialists to fix its health care system. And they finally had their answer. A single-payer system. One national health insurance plan, run by the government, covering everybody. All the money for health and medical care would flow through a single stream. It was similar to systems already in place in Canada and the United Kingdom. The planning stage for the NHI took 7 years, from 1986 to 1993. The national government would eventually fast-track the implementation of the new system to 1995. There was a lot of skepticism leading up to it, and a majority of people in Taiwan disapproved of the single-payer plan when it took effect. But the program's reputation quickly improved once people started to enjoy its benefits. These benefits include inpatient and outpatient care, prescription drugs, dental care, traditional Chinese medicine, childbirth care and other. Taiwanese citizens can see any doctor without a referral or a gatekeeper. They may also go to any level of hospital directly as they wish. This system has also short waiting times. There is generally no waiting list, and patients can normally see any specialist during the usual working hours. For example, if a patient sprains his back while doing house chores one evening, he may see an orthopedic specialist or a family physician directly the very next morning. Enrollment in NHI is mandatory for all citizens and for foreigners residing in Taiwan for longer than 6 months, and it currently covers 99.9% of the population. Part of its appeal to the population and the government is its simplicity. The system is mostly funded by payroll-based premiums, with contributions from workers and their employers, supplemented by more progressive income taxes and tobacco and lottery levies. 23% of the premiums come from the government, 38% from households, and 39% from employers. The patients receive a NHI-IC card, a smart card which is used to identify the person, store a brief medical history and to bill the national insurer for the healthcare services they receive. The hospitals will then claim the related charges from the government. Patients must also make co-payments when they visit the doctor or fill a prescription or go to the emergency room, but they are generally low, about $12 or less. Lower-income patients are not obligated to co-pay, and higher-income patients that want services not covered by the single-payer program can take out private insurance. Another important factor is the NHIA's powerful IT-driven administrative system, which provides high efficiency at low cost. The administrative budget for the NHI in 2014 was 1% of total NHI expenditure. This means more money is available to provide medical services instead of paying for administrative and marketing costs. One metric rating based on medically amenable mortality, which gives a sense of how often people die of causes that could have been avoided, tells us how the healthcare system has improved people's lives. In 1990, before Taiwan's single-payer program was implemented, the country held a rating around 60, far behind the United States rating of 80. In 2016, Taiwan had nearly caught up with the US, topping 85 while the US sat at 88. What it all adds up to is a system that patients all seem happy with. Maybe too happy. The easy access to medical care that this system offers creates a moral hazard. Taiwan's national health insurance has given patients such a good deal on medical care that they are overwhelming the system. Taiwanese people take advantage of their cheap, accessible health care. The average number of physician visits per year for a patient in Taiwan is 12.1, nearly double that of other developed countries. That has had a predictable downside. Crowded hospitals. Healthcare providers have difficulties attending everyone in need and has made doctors overwhelmed. The cultural belief in Taiwan that more healthcare is better drives up the demand for healthcare. On the supply side, competition for patients among providers that get paid on the fee-for-service system in Taiwan creates a supply-side induced demand for healthcare. Simply put, patients attend hospitals more because it's cheap and they want better health, and doctors are incentivized to want more patients so they get paid more. Seeing 50 patients in the morning is quite common for doctors in Taiwan. So each patient may receive only a few minutes of consultation. Such short contact time may result on a poor patient diagnosis in one visit. As a consequence, patients come for a second or a third time, contributing to even higher patient volume and higher medical costs. The large number of patient visits is a concern because there are 1.7 doctors and 5.7 nurses per 1,000 people in Taiwan, compared to the median of 3.3 doctors and 8.6 nurses in OECD countries. Compared to OECD countries, Taiwan has fewer doctors and nurses. These low ratios would be considered inadequate by OECD standards, especially in the case of high utilization of healthcare services in Taiwan. Taiwan is also facing a fast demographic transition. Its people are living longer, but fewer children are being born. In 2015, people aged 65 and over account for 12.5% of the population. By 2030 it will be 24.1%, and by 2050, 36.9%. Cost of medical care for the elderly will therefore become more of a concern as aging accelerates. Sustaining a single-payer system requires hard choices. By doctors who believe they're forced to see too many patients, by patients with complex and costly conditions who can't always access the latest treatments, and by citizens who have been asked and will be asked again to pay more for their health care than they did before. But these choices are not so hard when you consider the benefits of having an all-coverage, accessible, cheap and with short waiting times healthcare system. The majority of Taiwan's citizens today approve of their healthcare system. They know it isn't a utopia. The country has made hard choices to keep this program running, and it will need to do so again. Taiwan is realizing the dream of health care as a human right, that everybody regardless of geography, religion, gender, age should have the right to access. That's the essence of universal health coverage.